Let me thank everyone for joining us for this update as we enter the 60th day of our COVID-19 emergency activation in Denver. As of this morning, our community has lost 233 souls to this virus. To honor those we lost in Denver and across Colorado, and to remind us that we are in this together, Governor Polis has declared tomorrow a day of remembrance and will mark the occasion with a moment of silence at 7 p.m. We will also light the city and county building in red per the governor's request at that time. This pandemic is not only a public health crisis, it is also fueling an economic crisis, the likes of which we have not seen since the Great Depression. While we simultaneously try to save lives, we are looking to save jobs and protect those who are most vulnerable among us. So today, these are the topics we want to cover: our transition to safer at home, testing and tracing, social safety net, and our budget update for 2020. With me today is our Chief Financial Officer, Brendan Hanlon, better known as Robin, our Public Health Administrator, Bob McDonald, and my Deputy Chief of Staff, Aaron Brown. Let me start with some very good news. In the last few months, my administration has been in contact with Kaiser Permanente and their foundation. Even before the pandemic, we engaged in a conversation about how this important nonprofit philanthropy could be deployed in Denver to support our efforts around health equity and housing for those experiencing homelessness. As a result of those conversations, Kaiser Permanente Colorado is making a very generous $1 million contribution to the city's Housing and Homelessness Services Fund. This incredible contribution will amplify efforts to support our residents experiencing homelessness during this pandemic. We're very fortunate to have such a strong network of community partners here in Denver, committed to implementing real solutions to support our residents experiencing homelessness. And this support comes at a critical time for our community. And we're proud to be able to leverage this investment to help further protect residents from COVID-19. So we want to send a very loud and proud shout out to Kaiser Permanente Colorado for their generous donation. It's going to go a long way to help our most vulnerable residents. Now let me turn to other important COVID updates. First, it's been a week and a day since we implemented mandatory face coverings for people in many public settings. I'm happy to say, for the most part, people are complying and showing respect for their neighbors, respect and care for the welfare of their neighbors and customers during this time. Second, I could not be prouder of every resident and every business for taking the reopening guidelines to heart, making sure people are wearing their face coverings, setting up physical distancing measures, and implementing hygiene and other protocols. Now, we have received quite a few phone calls and posts on social media with residents expressing their frustration when they see other residents of Denver not wearing their face masks. And I share in that frustration. And I just want to underscore once again a call to care and welfare of our fellow neighbors, to respect each other's health and safety, and do everything we can to help protect each other by wearing our face coverings. This will help us to do the right thing, but also help us to get where we all want to get to much sooner if we all comply. And that this is not just my hopeful thinking, by the way. This is what we understand from public health experts both nationally and locally. And we are going to continue to continue a cautious and phased approach to the reopening here in Denver. This weekend, farmers markets will begin to reopen with health and safety measures in place for customers, including face covering and physical distancing. If you decide to go out shopping this week, please remember your face covering and keep your distance from others. We need to keep working together to keep everyone safe. I have somewhat of a funny story about that. Last weekend, I drove to the Home Depot only needing 2 small screws to finish a home project. 2 small screws. I drove about 4.5, 5 miles to the Home Depot. only to get out of the car to see the line and realize I left my mask at home. Everyone in line had their mask. I got back in the car, drove all the way back home to grab my face covering, and went back to Home Depot. But that's the kind of consciousness I have seen around the city, and it's greatly appreciated. Last week, I told you that one of our priorities is our phased reopening. In our phased reopening was increasing our capacity to do testing, particularly improve access to tests for vulnerable populations and underserved communities. Our mobile testing unit, Public Health and Environment's Wellness Winning, Bob, as you know, hit the road this morning delivering tests to those who can't get to the testing site due to transportation, mobility, or financial limitations. If you're a Denver resident who may be experiencing symptoms of COVID-19 or have been told by DDPHE that you may have been exposed and want to know if you qualify, all you need to do is call 311. They will ask you some questions to ensure that you meet the qualifications, and then you'll be scheduled for a visit. And you don't need a doctor's order to get the test. The Winnie will be stocked with about 100 nose swab tests at a time. Test results will usually be available within 24 hours, and then you'll be notified with your results, regardless of whether they're positive or negative. We also have nearly 100 of our Denver police officers and city employees trained in contact tracing, and they're on assignment now, getting in touch with people who may have been exposed to someone who has tested positive for COVID-19. The tracing will be conducted by phone or text, and this is work that will happen 7 days a week until further notice. When one of the contract tracers reaches out to you, they will always identify themselves, including their phone number. And they will never, and it's very important that everyone hear this message, they will never ask for things like your social security number or payment. They will just ask for the basics like your name and your date of birth, which will never be shared or sold. The objectives, of course, of why we are calling is to provide you information and guidance on how to keep yourself, your family, and our community safe. Now, regional partnerships will also be key here because the virus doesn't follow city boundaries, and we are forming those partnerships even as we speak. Now, I can't underscore enough how important this work is. I stated from the very beginning why we delayed our opening from departing from the state's order. Was because we want to put in place our testing apparatus, accessibility to those tests, and of course, contact tracing. It's about getting ahead of the spread of the virus, identifying potential cases, isolating individuals before the virus can spread further, and to help avoid another community-wide shutdown. So if you get that call, please be responsive so that we can continue the effective effort around contact tracing. Now, we're all very aware of the impacts this virus continues to have on our community. Many Denver families have disproportionately had their financial security disrupted, and I want to make sure we're doing everything we can to support them through this extremely difficult time. Under the leadership of my Deputy Chief of Staff, Aaron Brown, who is here, I've stood up a social safety net team that will help ensure the community's connection to available resources and benefits and maintain stability for these families. The team will have a foundation of providing equity to keep us focused on changing needs for our vulnerable and underserved communities in everything from housing, health, food, economic stability, and security to caregiving and youth services. Our goal here is to shore up access to these supportive services so these families don't fall further behind. This work is especially important for our residents in need right now because this public health crisis has caused an economic crisis that has to put it bluntly, created a difficult budget situation for everyone, including our city government. Now, everyone has at least shared or at least heard this information already, but it's worth repeating. We are now projecting a $226 million budget gap due to lost revenue. From the start of this, we took several steps to cushion the impact of our budget, including reduced hiring, requiring departments to find 7.5% in reduction proposals, and other agency savings and reductions. Because of these early steps, as well as our work to maintain healthy reserves over the past 9 years, thankfully, Fitch Rating Agency recently reaffirmed Denver's AAA rating, bond rating, which is very important as we address and approach these challenging times. They also said we were one of the cities well positioned for economic recovery because of this work. But let me be clear. We are going to have to make significant cuts in spending to close this budget gap here in 2020 and as we look toward 2021 budget year. It will mean reprioritizing how our public investments will be able to move, to move forward. And unfortunately, it will mean we will have to reinstitute furlough days for our city employees, the first since 2011. For this year, we will have 8 mandatory furlough days, 5 of which will coincide with national holidays, and the remaining 3 being flex days that city employees will have to take by the end of the year. And I want everyone to know that we have worked to exhaust every other tool we had before taking this step. Now, I was on City Council when then Mayor John Hickenlooper had to make this very difficult decision back during the Great Recession. I know how tough this was for our employees. I will be taking the furlough days as well, and so will those in my administration. I want to thank Council President Jolyn Clark for being here today, and I want to thank those 12 City Council members who have already committed to take the furlough days and to join city employees in this challenge. Now, I want to say loud and clear to our leaders in Washington, this is why our cities and states need relief in this next stimulus package. Cities account for 91% of this country's GDP. We are the economy. The House is voting on a new relief package on Friday. We need the Senate to follow their lead and not drag their feet on this bill. We need our entire delegation to be in lockstep to help the state of Colorado and our cities to begin the process of this very important recovery. I did speak with Senator Gardner this morning. We had a very candid and positive conversation. I want to remind everyone that Senator Gardner wrote a letter in partnership with Senator Bennett and Governor Polis and that was sent to the White House encouraging a national stimulus bill to support our states and our cities in recovery. So we accentuated that commitment, reconfirmed that commitment, and the commitment to work together to make sure this happens. The reality is this: if cities can't recover, there will be no national recovery. These are extraordinary times, but I have confidence that we'll pull together to get through these times. Now, I'm going to turn it over to our Chief Financial Officer, Brendan Hanlon, who will provide more information on the budget situation. Brendan, and let me thank you and Stephanie Adams, our Budget Director, and your entire finance team, who have not only helped to manage this city very well before the pandemic, but during the pandemic, and help shape and position the city to do well as we work to try to come out of it.
Thank you so much, Mayor. I appreciate it, and the team does as well. It's a fantastic team, and they make me look good every day. Good afternoon, Brendan Hanlon, the city's Chief Financial Officer. I'm here to talk a little bit about our current economic and revenue challenges that we face as a city. The mayor is correct and indicated that we are revising our revenue loss projections to $226 million below our original forecast. That's a $46 million loss compared to the 180 that we had announced before, and that is primarily driven by sales and use tax, lodgers tax, occupational privilege tax, and parking revenues. So we've seen downward trends in each of these areas. Great. Next slide. So types of recovery. We in finance are modeling a variety of different financial conditions, and this is something that all cities are going through right now, and our private industries are going through a process like this as well, and they're trying to model out and navigate their way through a lot of uncertainty. And I will tell you that models like this are continuously updated. We know what we know right now, but there is a lot of uncertainty on the horizon. We will have to continue to refine our economic assumptions and therefore our revenue assumptions as we move through this process. The graph on the left illustrates the modeling we're using for our baseline forecast as well as alternative scenarios. And what you see, and for those of you who maybe watch CNBC or the Wall Street Journal, or read the Wall Street Journal and whatnot, they talk about different types of recoveries that we as a country, states, and cities might be experiencing. And the first you see is a V-shaped recovery. That is a significant loss of revenue and then close to an immediate restoration of that revenue performance, a very quick loss and a quick recovery. A U-shaped recovery, which anticipates a severe loss of revenue again, but then a longer-term recovery over possibly multiple years. A W-shaped recovery, where we experience a significant loss, some restoration and economic growth, and then you can imagine a condition like a resurgence of the virus in a fall-winter time period, which would then bring about another economic impact and then on to recovery in the future. And then lastly, and probably most concerningly, an L-shaped recovery, which is a significant loss of revenue and operating from a new, lower economic and therefore revenue performance as we would recover over multiple years, which would be a significant challenge. The graph on the right shows Denver's projection for sales and use tax. And the reason that we're focused on that tax is because it represents 50% of our general fund, which is where we fund our core services. So those traditional services that you think of in terms of police and fire and street maintenance and trash collection and the Department of Finance, we are funded out of the city's general fund. So we spend a lot of time modeling what our revenue performance is going to be in that category. And what you see is multiple scenarios. You have a baseline scenario, which was our original forecast pre-COVID. You then have a different scenario which is below that, and there's two of them, and it's kind of a before and after picture of a U-shaped recovery. So we're not focused on a V-shaped recovery right now. We're certainly not focused on a W or an L, but a U-shaped recovery which would show us recovering financially over time after a significant shock in revenue. But we have to continue to observe the economic performance nationally, across the state, as well as locally. We are not an island, and our financial and economic performance doesn't operate in that fashion either. So we are going to continue to maintain our observation of other economic statistics as we move forward. Consumer activity. Because we are so reliant on sales and use tax, we want to make sure that we're always monitoring the performance of our sales and use tax specifically, but also then our consumer behavior, because that is a direct effect on our sales and use tax. What you see in front of you is a comparison of March 2019 performance to March 2020 performance. And in the yellow bars, in the blue bars, that represents the U.S. sales, and the yellow bar represents the retail sales in Denver. So this is a helpful comparison to see how we are tracking similarly and dissimilarly to other economic performance and consumer performance, both locally and nationally. And what you see is there are some areas of strength. Online sales, grocery and beverage stores, we saw some positive numbers in those categories, while other sectors are suffering losses both nationally and in Denver, and some of the losses that we're experiencing in Denver are more significant than what we're seeing nationally. So it presents us with a particular challenge. Nationally, in March, consumer spending slumped by a record 7.5%, and personal income fell by 2%, all major factors in terms of that sales tax forecast that we're so focused on. Total sales, which include retail purchases in stores and online, as well as money spent at bars and restaurants, nationally fell 6.2% in March 2000, from March 2019. That's the biggest year-over-year decline since September of 2009. So we're dealing with some really challenging circumstances. And I think it's important to remember that in March, we were just starting to see the beginning of stay-at-home orders being put in place. We have probably about a half month's worth of maybe more traditional economic activity. And the second half of the month was once those orders were in place. For the same period of time in Denver, traditional sales for retail and food services fell by 20.4%. And especially in areas like food and dining establishments, clothing and apparel, and vehicle sales, all very major categories, and these are our largest performing categories in our economy in Denver. And I would have to say it's unfortunate to have to note that in April, the report is expected to be one of the worst months ever, both nationally and here at home. So we will have further updates in our economic and revenue performance as the months proceed. On the next side, you see a comparison and some history of what we've experienced in the past. In 2009, that was the impact of the Great Recession. Those numbers were astonishing when we experienced them. I was with the city, a lot of the finance team was here with the city, and personally, and I mentioned this on the phone with some folks earlier today, it was what I expected to be the most financially challenging period of time in my whole entire career. I could have never imagined seeing the numbers that we're seeing right now and the gravity that it means to the services that we provide to the public every day here in Denver. What you see is a 10.5 loss of revenue, 10.5% loss of revenue in this chart compared to a 6.4% loss in 2009, so a significant increase. On the next slide, our lodger's tax slide, it's truly breathtaking the impact that we're seeing in our hospitality and tourism industry. They are a significant driver, not just primarily due to lodger's tax collections, which is a tax that's charged in a room's night worth of a stay here in Denver in a hotel room, but you have to think also about the secondary and tertiary impacts it has on our economy. Those people travel to Denver, they don't live here, they then spend money in our stores, in our restaurants, in our different businesses. It has a tremendous secondary and tertiary type impact to our economy. We are looking at an 8.5% impact from back in 2009. Again, those were staggering numbers when we first saw them, but a 62% loss in that forecast for 2020. It is some of the most challenging numbers that I've ever seen for that category, and it exceeds certainly 2009 and anything we've seen in history. Lastly, but maybe most importantly for the general fund, that makes up 50% of our overall funds in the general fund, we saw a 10% drop in 2009, and we are estimating currently a 16.8% impact in 2020. That is for 50% of the revenues in our city's general fund. Again, the fund that provides for street maintenance, our rec centers, finance, police services, fire services, a tremendous impact to that revenue stream. That's why we have leaned in this challenge, and I think the mayor put it really well. One of the reasons why Fitch and other financial institutions rate us so highly is for our financial management practices. When we see a problem, we respond immediately. We do not wait. And that is why we have set aside reserves to accommodate a circumstance like this. So that way we have some safety net that's in place for the city's finances, and we're planning on using those. The agency reduction proposals, 7.5%, we're reviewing many of those now, and they'll be implemented over the weeks to come. And then there are also citywide savings that we have begun implementing. So think of reductions in our capital equipment purchases and our fleet purchases, those things that while we wouldn't otherwise be taking them, they present themselves with some optionality right now, so that way we try to avoid impacts to our service, our direct service provision, as well as our employees. But unfortunately, those measures will not be sufficient to meet the challenge that we're facing. And because of that, we did have to announce 8 furlough days for city employees for this year. And 5 of those days, as the mayor described, will be scheduled, will be fixed. A structure like that does provide the city with some additional savings when we close a facility. It does save on utilities and other secondary costs that are generated by having our facilities open. And then there will be also 3 flexible days as well, so that way employees can plan and accommodate them throughout the year. Before I turn things over to the mayor, I just want to repeat his compliment that he was giving to our finance team. We have a lot of folks who were here not just during the Great Recession, but also during the recession in 2001, after both 9/11 and the tech bubble burst back during that period of time. We are bringing that experience to this challenge, and I'm just committed to making sure that we work with the mayor and the administration and all of our appointees and our managers and our elected officials and our city employees to ask for their ideas, look for efficiencies, implement those items that would really help us avoid service impacts and impacts to our employees. And one of those tools we're going to be using this year, which Fitch complimented us on, is our reserves. That, again, that's why those reserves are there. $261 million at the beginning of this year was set aside for an emergency type situation, and we're using it in an emergency. And we could be using between 90 to $100 million this year to cushion this blow. And it is a blessing that we have managed our city so well to have that kind of tool available, because it is not a tool that all communities have. And we're very fortunate to have that tool to buy us some time to make the tough choices we're going to need to make. But I think what our commitment is to try to make sure we minimize those services impacts to the public as much as we possibly can, even though with $266 million worth of revenue challenges, that will be extremely, extremely difficult. But we're going to be really thoughtful and intentional about this and lean in as quickly as we possibly can, as we have done already. With that, I'll turn it back over to the mayor.
Thank you, Brendan. And we want to, before we go to question and answer, thank our city employees as well.
Yes.
Even though we went to 90% of our employees working remotely, they have continued to work, and they have been absolutely dedicated. No one, we did a conference call yesterday with a town hall with our city employees. A lot of great questions. Their willingness to lean in. We've heard from many of them. They're going to continue to share ideas. I want to thank them. I want to thank the men and women who have remained, who reported to work every day still as essential employees. Our men and women, our first responders. Chief Payson is here. Thank you. All the men and women who showed up in our emergency operations center, not asking questions except for where can I be helpful and where can I make a difference in helping to save the city. So thank you to our 13,000 city employees. Let's open it up now for question and answer, and we'll do our best to answer your questions.
Are there any questions?
Hi,
Yeah,
this is
this
Lori
is
Lazar-
Esteban. There's not. Go ahead, Lori. You started first.
Thank you. This is Lori Lazaraga with 9 News. I actually had a question for the mayor. I was hoping that you might be able to elaborate a little more on the social safety net team that you said you're organizing, and when we can expect to see that go out into communities.
Absolutely. I'm going to ask Aaron to speak to it as the lead on that effort. Aaron?
Yeah, absolutely. Thank you, Mayor. Thank you very much for the question. Yeah, we have put together a very comprehensive group to continue to work on this. And so I think the thing that's really important, this group, as to the mayor's point, we put this group together to really ensure how do we help minimize the economic and social stress that our families are feeling right now because of COVID-19. And to do that, we recognize we cannot do it alone. So we put together a council that's made up of not only city agencies, but our community partners, nonprofit partners, our community advocates, healthcare professionals, to really help us think about what are the most important things that families need to make it through this time. We really recognize that when we launched, we were doing a lot of this work when we activated our operations center. And as we're moving into what we're calling recovery, we want to make sure that these systems stay in place and that we're removing barriers to ensure that our residents have access to the critical resources they need during this time.
Do you know
This
when
is
we'll start
Esteban.
to see those resources in the community? When will people be able to start actively seeing that help?
A lot of the help has been occurring. We've done everything from ensuring that there is emergency food in many food banks and pantries that are in underserved neighborhoods. We're continuing to figure out how we connect with our child care providers so they can stay open and continue to provide services, and how we're creative around that. And so you've been seeing some of it. I would say over the next 2 to 3 weeks, you'll start seeing more connections around benefits and how we leverage that. Our Human Services Department here in Denver, they're doing an incredible lift, and their uptake of those benefits have increased probably triple-fold, and we will continue to see how we partner with them to ensure that families have access and how we're innovative around removing those barriers so families have access to much-needed benefits, everything from temporary assistance to SNAP benefits to medical benefits.
It seems like forever when we first started this effort, and I'll tell you that at the very beginning, I remember things like our team, our equity team and our Emergency Operations Center working with United Way to fund our food banks. Our police officers have been handing out food. They are driving around with items in their trunks to feed families, and we thank our officers for that. Our TRUA program has immediately was deployed or was made, we publicly talked about our temporary rental utility assistance program, being ready to assist those who needed help with utilities and their rental assistance. Our efforts to push for congressional recovery and support to help families directly. All these things, it seemed like forever ago that we started those efforts, but now what we're also doing under Aaron's leadership and this team's leadership is really connecting the dots, making sure the tissues are interconnected so that we can be more concerted in our efforts and make sure the right hand knows what the left hand is doing. Go ahead, I'm sorry, there was a follow-up?
Esteban?
Yeah, was there a reason lower wage workers weren't spared from the furlough? Did the city give any consideration to help lessen the financial blow for them?
Mm-hmm. So this is Brendan Hanlon, the city's chief financial officer. So this is a tool that we have deployed across the whole entire city for all city employees. It's a shared sacrifice model. So this is how we've traditionally implemented this program in the past.
And we are also going to continue to work to provide some support for employees who may need it going forward as well. But this design this time around was also designed to help employees take advantage of maybe unemployment benefits while they're continuing to work based on the hours. And so we were very intentional with that.
And Mayor Hancock, are you required to take the furloughs as well, or is this voluntary?
It's voluntary for elected officials, and let me tell you why. There's a state constitution or a clause in the state constitution where elected officials' salaries cannot be reduced or increased while they're serving. And so as I did when I was on city council, as I did when I became in as mayor, I didn't accept the raise that came with the raise that was instituted to increase the mayor's salary. As I came in as mayor, I wrote a check back to the city for that, and I'll do the same thing so I can stand with city employees and help the city through this challenge.
Next person?
Hello, Mr.
Megan.
Mayor. It's Rick Salinger from San Francisco. The question that I have involves what may be the epicenter of Denver, south of the coronavirus, the downtown detention center. There's well over 100 positive cases that have been tested inside there. And one of those who was tested positive, an inmate, reached out to us and said that he's pretty sick and that what they're telling us about how they're helping them inside isn't true. And he even said that some inmates who tested positive were moved into his pod before he had acquired the virus. I was wondering how you respond to that, please.
I got to tell you, Rick, I could hear very little of what you said. Is there anyone at the table who can articulate anything that he may have said? Can you make it more succinct, Rick? And if you are, I don't know if you have us on speaker or what have you, but it's very difficult to hear what you said. I think you're asking a question about detainees in the jail.
The question is about the large outbreak in the downtown detention. The large outbreak in the downtown detention center. Inmates are complaining they're not getting good enough treatment. How do you respond?
Yeah, let me just say this, that it was the protection of our detainees in the detention facility, as well as our sheriff deputies, was one of the very first priorities that we had in order to try to blunt the spread of the transmission of the virus. I will let our director of safety, Murphy Robinson, respond to how we are responding to that situation inside a detention facility. Murphy?
Hi, everyone. Murphy Robinson, Executive Director of Public Safety. Rick, thank you for the question. We are working diligently to make sure that our inmates as well as our staff inside of the detention center see the most care that we can during this pandemic. I will note that we have experienced an uptick in the numbers when it comes to the folks testing positive in the jail. And the reason for that is because we've elected to test all inmates coming into the jail. Not only have we decreased the numbers in the jail by half to where it's about at 1,000 inmates right now, but we have also wanted to make sure that we understand as folks come into the jail, our inmates come into the jail, if they're positive or negative. And so the reason we have that uptick in the jail is because we started to test everyone. We consistently work with Denver Health Hospital Authority to make sure that we're implementing standards set set forth by the CDC, but I would also say we've deployed masks to every inmate, we've deployed masks to every deputy, and we want to make sure that we are leading the state as well as the region in how we take care of our inmates and the population.
Well said, Murphy, and let me just go back to a point that you made very early in your statement. We typically run between 2,100 and 2,500 detainees per day, everyday numbers. That number is reduced in half because we started this process by saying, working with county courts, working with the Sheriff's Department, the Denver Police Department, that we did not want to put people in the detention facility if they were not a threat to the public for this very reason, to contain and to manage the spread and of the transmission of the virus. And so that number has been going down steadily, and it's about 1,000, probably less than, a little more than half of what we used to have.
Thank you.
This is Megan Lopez with Denver 7. A couple quick questions. So first of all, the 8 planned furlough days, it's projected is going to save the city about $16 million, but that's just a very small dent in that $226 million budget gap. Where is the rest coming from? What are some of the other steps that you're taking or that you have taken before this? And then also Councilwoman Sita Baca had raised some concerns that were aired in Westward, kind of expressing inequities in how the furloughs are being spread out among everybody, and saying that she is going to not voluntarily give up hers. Can you respond to that, Mayor?
Well, let me say it this way, and this is the only time I'm going to address any elected officials' desire not to participate in the furloughs, because it is their call. But I'll use the example of the prophet Jeremiah, and I'm going to paraphrase it so that it fits, because it fits the situation. Jeremiah said, "If I am a voice of justice for my people, but I don't lead with love, with a strong work ethic, a willingness to strategize on solutions, and to come to the table with a collaborative spirit, then I'm just a resounding gong and a clamoring cymbal." And that's the reality of what we're faced with. Either you lean in with ideas, as many council members have done during this challenging time, offering ideas on how we can help manage this situation. Come to the table with solutions and ideas. So the reality is, as Brendan Hanlon pointed out, this city has been managed well. The rating agencies have confirmed it, with our AAA rating being reconfirmed, and the fact that they hold Denver out as one of the examples across the nation as one of the cities that will emerge from this probably faster than others because of the things that we've done and the things that we are doing. Now, I'll let Brendan talk about it, but in order to close the gap of $226 million, there's a myriad of things, rocks that we had to turn over. And we did those things first before we turned to city employees and what we can save there. But I want to stress once again that city employees, as they did in 2009, will participate in this process. We recognize that this is a burden on city employees. I know that. I was there in 2009. I listened to the stories and testimonials. I'm hearing from city employees today. I know this is difficult, and that's why it's a very difficult ask to make. But Brendan, you want to talk about all the other efforts?
Sure. As I mentioned during my presentation, one of the things that we've focused on are those transactions, so capital equipment, purchases, transfers to our capital improvement fund. We also, all agencies have been looking at all of their vacant positions and holding off on hiring. We've not suspended hiring exclusively across all city agencies, but they have slowed that hiring down, and they're looking for ways of slowing that hiring. We also looked at training and travel and other discretionary budgets and have begun that implementation already. That has gotten us part of the way there, but I think the magnitude of the challenge that we are facing requires multiple solutions, and that's what we're looking for here.
And then I just have one more semantics question about the reserves, and this might be better suited for the Chief Financial Officer. From what I heard, if I heard correctly, $261 million inside of that reserve. I understand you're using about $100 million, and I know that you can't use all of it. Can you kind of explain what happens with the rest of it and why you can't use all of it?
Sure. One of the examples of our financial management practices that the rating agencies focus on is our reserve policies. We have that $261 million, but you are correct. We have set policies in place that guide our financial management practices that ensure that we have financial sustainability regardless of the economic or revenue proposition that we're in. So if we were to use between that $90 to $100 million, that would bring us down from an 18% rainy day fund to a 12% rainy day fund. And the reason that we're using that increment and trying to stay at 12% is to prepare ourselves for any future revenue volatility we might experience in the end of the year and the beginning of next year. So again, it's a series of conservative practices that when you add them together provide the safety net that we need to weather a situation like this.
And let me just say that the overall financial performance of the city, which includes our reserves, our savings account, goes into the account of what our debt costs us. And so every city in this nation is careful not to dip below a certain percent, and typically here in Denver, and typically the markets say about 10%. Once you do that, now the debt that you carry costs more money because you have a greater risk. You're at greater risk of being in trouble, if you will. If something were to happen, as we have seen very dramatically in 90 days, our entire financial portfolio disrupted. So it is very important that we manage to stay above that number. When I became mayor in 2011, I talked about how dangerously close we were to dipping below 10%, and it was very important. That was the magic line that we did not want to do, and we need to turn things around right away.
That's right.
Hi, this is Vicente Arenas with Fox 31. How many employees are we talking about? Will police, fire, EMS be affected? And is there a possibility you might need to do this again either towards the end of the year or next year?
So this is Brendan Hanlon, the Chief Financial Officer. So the total number of citywide employees is about 12,000. Now, I will say I believe my estimates are correct at about 5,000, which are uniform employees. All non-uniform employees will be taking a furlough. It's important to remember we have collective bargaining agreements that are in place that would not allow us to apply furlough days to uniform employees. So it would be the balance outside of uniform employees. Oh, I should just mention, because the second part was about next year, we're beginning the work on the 2021 budget. We have not predetermined whether or not this tool will need to be used next year. I think a lot of it depends on that federal support that the mayor was talking about. If we were able to achieve federal funding that offset these revenue losses, it might put us in a better proposition. But we're going to work through those numbers over the coming months and have a recommendation for council and the public in September.
And let me just say this, because again, this seems like eons ago, but those CBAs or collective bargaining agents or units did approach very early on, approach the administration to have a proactive conversation about how they can help the city through a difficult time. And so we are having conversations with the police and fire on those issues. So we want to thank those uniforms for doing that.
Is there
Thank you.
Mr. Mayor, I have a follow-up question. This is Lori with 9 News. I appreciate the effort that we just talked about to get the resources and access to testing to our underserved communities. I know the mobile testing unit was announced more than a week ago now, and today it'll finally start going to those underserved communities to offer the free testing. But by now we're 2 months into this. I have to ask, what's taken so long to get free mobile testing to the underserved communities where we're seeing cases rising?
Great question, and let me turn over to Bob because there is an answer for that.
Yeah, Bob McDonald, Public Health Administrator and the Director for the Department of Public Health. You know, ever since the beginning of this pandemic, even before we had our first case, we were doing everything we could to assist those in our underserved communities, focusing on educating them, getting supplies out to them when we could, even before we had our first case. The challenge with the testing was not our willingness to do that, to do what it takes to serve them and serve them well. The problem was availability of kits. The test kits are now starting to roll in. We secured, I believe, a couple of thousand yesterday. And I'm happy to announce that everyone who has called in to ask for a test has either been tested or is scheduled to be tested. We reply the same day, generally. If not, if it's a call late in the day, we can get out the next day to get that testing done. And again, we go to that person's home, we do the test there, we take that test to the lab, and to the mayor's earlier point, we make sure that we report that back to them. And then and if it's a positive, then we start the contact tracing part. And even during that process, when we're doing contact tracing, asking individuals who might have been exposed to that initial case, what do you need to follow through with isolation? Do you need assistance? Do you need PPE? Do you need, what can we get to you to help you with that quarantine period? So the delay was, a lot of it had to do with available tests. I'll also share that there was a mention of a doctor's order needed for everyone who needs a test. And again, now that's been remedied. We signed off on that standing order yesterday. So anyone who needs service off of the mobile unit, you do not have to have a doctor's order now. We removed that barrier. So things are going very well right now.
And we hope to continue to bring you more good news in terms of accessibility for testing in the city of Denver as the days go along. But I got to tell you, there's a whole task force of folks working hard under the leadership of Murphy Robinson and Bob McDonald to break down barriers and get testing not only available but accessible to our residents.
Last question for someone who hasn't asked a question yet.
Yeah, Jesse Paul here at the Colorado Sun. I wanted to ask how the decrease in passenger loads at the airport has affected the budget, and whether that's really impacting things and leading to part of this necessity for the furloughs.
Yeah, I'll remind everyone, the airport is an enterprise fund, so it doesn't receive any money from the general fund. But it has been greatly impacted. The passenger numbers are down 90% at the airport, which means that concessions are greatly impacted, means that other revenue streams at the airport, including parking, are greatly impacted. Landing fees are greatly impacted. So the whole infrastructure around aviation and air travel have been greatly impacted. And so we've had to work closely with our concessionaires and make sure there were some concessions for them, and as well as our airlines to help them through this difficult time. At the same time, the airport's having to deploy its reserves, is having to make some moves to protect itself against this downturn as well. And so Kim Day and Gisela Shanahan at the airport, the chief financial officer at the airport, working closely with Brendan and the rest of the management team to make very, very difficult decisions to keep one of the nation's, actually one of the world's best airports solvent during this difficult time, long enough to give it a chance to rebound as people begin to travel again. All right, thank you all very much.